Is Batman bat crazy? Up next on Science Goes to the Movies. Welcome to Science Goes to the Movies, a look at the stories of science and how they change our culture. I'm Lisa Beth Kovitz. Dr. Robert S. Rosenberg is the clinical psychologist who wrote your college textbook, Abnormal Psychology. She's also the Uber editor of the Oxford University Press Superhero Series. Today, we're talking about her book, What's the Matter with Batman? Welcome to the show.
Thanks for having me.
In 2021, we're getting a brand new Batman when Robert Patterson dons the cape and cowl and heads out to save Gotham, bringing with him all the guilt and darkness that comes with being Bruce Wayne. So what's in that darkness? In her book, What's the Matter with Batman, Dr. Rosenberg compares Batman's behavior with the Diagnostic and Statistical Manual of Mental Disorders, the book that delineates guidelines for abnormal psychology. Dr. Rosenberg, I'm just asking for a friend. If you knew a guy who dressed up like a rodent, spent millions of dollars on a hobby, and had no real personal life, should you be worried about him?
I would want to know more before I was worried about him.
So let's break it down. I think it's a great step forward that modern Batman wears his underwear on the inside. But still, if Batman was a man and Gotham City was real, would it be weird that he dresses like a bat?
Excellent question. Yes and no. In New York, of course, it might not be weird at all if you see how people dress on the street. It's a costume. And if we had one firefighter wearing the firefighter costume, that would be weird, right? But it's because it's a uniform for everyone. So if superheroes all dress in costume and the villains dress in costume, all of a sudden it's not so weird. It's a variant of an individual variation of a uniform.
Batman is smart like Tony Stark, and he's rich like Tony Stark, but unlike Iron Man, he never seems to have a good time. Batman is always only focused on his work. Would you, as a therapist, be concerned about that?
You asked two different things. Let me answer them separately. So one is about he doesn't have a good time, and I would argue that he does have a good time, it just looks different. That a good time for Tony Stark is different than a good time for Batman. Batman gets pleasure, if we want to frame it that way, from apprehending criminals, from figuring out in advance, preventing something from happening, from saving someone. That's a good time.
That's a good time for Batman.
That's a good time for Batman is kind of doing good. It's quiet. He's not a laugh out loud kind of person, but that's the range of human nature, right? Not everybody is a party hardy kind of person.
Right.
Is it of concern that he spends so much of his time and energy in pursuit of his mission? Well, let me, phrase the question a little differently. Someone who's a thoracic surgeon and has spent 12 to 15 years training and spends most of his or her time at a hospital, saving patients, being on call, having to cut short, their personal life. Is that a problem? Someone who's an Olympic level skater, who's given up many things in order to pursue their goal. Is that a problem?
No.
Everything has benefits and costs. And so it's very clear what the benefit is. It's incredibly meaningful and powerful to him. And one of the things we know from research in the workplace is meaningful work is an amazing protector against burnout. And so he has incredibly meaningful work.
Right.
Is it a problem? We'd have to really zoom out and say, well, what's the downside of this? Is he unhappy? Is his life maladaptive in other ways?
Well, he's heavily injured, heavily and frequently injured. I like Batman. I'm okay with Batman, but devil's advocate, His body is taking incredible trauma. He has no friends except Alfred.
I'll take issue with that one too.
Go ahead.
So he has love interests, we know. So it's not as if he has no personal life. Well, there are many incarnations of Batman, but in some of them he's part of the Justice League. So he has a cohort of friends with whom he does activities together. In some versions of Batman, he has sidekicks. And so he has and Alfred right there, and so he has family. And in his capacity as Bruce Wayne in Wayne Enterprises, he has colleagues and employees with whom he's close. So I'm, it depends on which version of Batman you look at and what slice of that.
Yeah.
But there are many people who, that's kind of the life they have. It's not that different, and it's rich enough for him. He doesn't view it as problematic, and he's not, in fact, isolated. He's not really totally isolated. You talked about his getting physically injured a lot. Is it a problem that someone chooses to be a football player? In this day and age, when we know all about what happens with head trauma, the sort of repeated head trauma in the ways that it can really screw someone up for life, how is it different in the way that you're talking about?
I don't think it's different, but I think it's a very complicated choice, and I think you're first starting to see the very first football players walk away before they get really injured. Football players have physically, football players are very similar to superheroes, and they, for the first time, are saying no thank you, and I think that that's a huge change in our society.
Right, I totally agree. My point was simply Batman is not unique in his being willing to step into the line of fire, and even knowing that it has a physical toll. Same thing for firefighters. It's different kinds of injuries, but there are many first responders who go above and beyond and are willing to do the opposite of what our brains tell us, and they run into danger, basically to help us. And that's remarkable. It's an amazing gift.
It is.
To give people.
Is it also that Batman's life is more fulfilling than Bruce Wayne's?
So all of us have alter egos. Okay, so there's me, however I think of myself. There's me as a mother. There's me as a psychologist. There's me as a guest being interviewed on this show. There's me as a spouse. We all have different parts of ourselves. So it's not as if they're radically different. And so when he's Bruce Wayne, when he's wearing a suit, he's the same person, just like I'm the same person when I'm seeing clients, when I'm, with my kids. I have different facets of myself that come forward, but I'm the same person. And it's the same thing. He's the same person. When he's wearing his three-piece suit, sometimes it's in the service of Batman, right? He's trying to get some information. He's sort of undercover, if you will. Sometimes he's running Wayne Enterprises, and that's ultimately in the service of Batman and society doing good, and because it gives him the money to do what he needs to do. So it's they're different parts of the same whole.
Most superheroes have secret identities of necessity, but the Dark Knight is one of the few that refers to Bruce Wayne, his other self, in the third person to himself within his own comic thought bubbles. Would that worry you about Batman?
No. Nothing by itself that you've mentioned would worry me. It's, again, you have to look at the totality and what the context is. So sometimes when people get married and change their name, they may talk about their new married name in the third person, right? Or when someone gets their doctoral degree, like, Dr. Rosenberg, because that's not me yet, right? It's a sort of change in identity. So the fact that he's calling out, this is this other alter ego, this other part of him, that he dons a suit, sort of he passes, if you will, but his core identity is as the Batman.
And so that's a healthy way to view your secret identity. What is
It could be. It could be.
Could be. Which I think we can all understand. I mean, I will tell you that I feel that the girl on camera is different than the girl who will edit this, and we're the same person. Where does it become unhealthy? What should friends of Batman look out for if his behavior suddenly changed?
So if when he talked about Bruce Wayne, he actually thought that was a different person, like a literal physical different person,
Yeah.
that would certainly be a concern. Dissociative identity disorder used to be called multiple personality disorder. It's a controversial diagnosis. If either Bruce Wayne or Batman was not aware of the other persona, had kind of gaps in time when he had no memory, but clearly time had elapsed, those that would be problematic. In dissociative identity disorder, part of the diagnosis is that the different selves don't really know about each other, which is very different than what you're talking about, where he intentionally knows there's a Bruce Wayne persona.
But that's got to be extremely difficult for a clinician, because that means that he has to come in and say, I'm having gaps in time. Whereas all these other normal elements of behavior could lead to something. How do you dig? How does a clinician dig?
So for this disorder, for this particular disorder, dissociative identity disorder, sometimes the digging can create downstream problems, because it in a way sort of suggests new symptoms. I mean, that's part of why it's controversial. That's part of what the training is for, is how to ask patients and clients questions without leading the witness, if you will. I mean, and similarly, we know that there are ways that you should ask witnesses to crimes questions without leading them. We now, from a lot of research in psychology now,
right?
We really know how it should be done, and that's part of what training is for.
But we also talk a lot on this show about the CSI effect, the way pictures and comic books and cartoons and all of these stories are affecting the actual function of the profession. And I myself throw around psychological terms like confetti. I would say multiple personality disorder. How much is that sort of infiltration of what we see on TV, the CSI effect, hitting clinicians and patients also?
That's a great question. I think that it partly comes down to psychiatry and not psychology. So I think it's about 20 years ago, maybe 30 years ago, the laws changed and pharmaceutical companies were allowed to market directly to consumers. In the past, they weren't allowed to.
Oh, yeah. And
so there's a school of thought that in marketing to consumers, it's basically creating demand, which of course benefits pharmaceutical companies. And people say, oh, I have those symptoms, so maybe I need that, so I must have a disorder, right? And so that's a kind of backwards way into your question, where it's sort of through.
Right. Well, there's a line in your book that reads, "Seen through the lens of meaning making, many of Bruce Wayne's quirks of behavior lose their weirdness."
Right. So dressing up like a bat is weird, right? So having minimal social life. So we can go through all the things we've talked about, and each one in isolation is weird. I'm not going to say that it's pathological, but it's quirky. It's unusual. When you understand his origin story, which was only 2 pages in the original version, it was very short, it all makes sense, right? We understand, oh yeah, he has become a social activist.
Interesting.
And that's why he does what he does. He profoundly wants to make sure, he wants to participate and do everything he can to protect other kids from becoming orphans, right? The way he became an orphan. So if he can't prevent it, at least to then apprehend the criminals afterwards and bring them to justice. That's the meaning that he has made, and everything he does revolves around that.
So is Batman's behavior reasonable because it works? Is the real life functionality of somebody's behavior a major component in a diagnosis?
Most of the time, yes. For many diagnoses, it's how functional they are, how adaptable they are to the demands of everyday life. Do they experience distress about whatever it is? I mean, he doesn't really experience distress about his life. He's not lonely. You know, he doesn't feel a lack of a personal life. He doesn't view the pain he endures as problematic. It's just part of the job. He's willing to do it.
As a social activist would.
As a social activist would. That's just the cost of doing business that he chooses to do.
Right.
I mean, he certainly has existential crises sometimes. He'll have flashbacks from PTSD, post-traumatic stress disorder, but he takes it in stride. It's just part of the cost that he's willing to pay.
You know, we keep talking about the Diagnostic and Statistical Manual of Mental Disorders. What is that?
So that is a book published by the American Psychiatric Association. It's in its 5th edition now, and it is categorizes disorders, and it has a menu, if you will, of symptoms that people must demonstrate in order to qualify for their behavior or mental processes to qualify for a diagnosis. It's currently built mostly around behaviors. The first edition was very psychoanalytically oriented from its time. There are some problems with it, as there would be for any diagnostic system. It's the one that we use in America. It tends not to be the one that's used internationally. There's another manual, an international classification system that's used in other countries, and may in the end be what we turn to. But in order, again, comes back to money, which is for when people have a health benefit. In order for services to be paid for, people have to have a diagnosis. And for a mental illness, right, for a mental disorder, it has to be something from the DSM, the
That is an
DSM-5.
extremely modern complication.
Yes. So it's you can understand from a health benefit perspective, insurance companies' perspective, in the same way they don't pay for cosmetic surgery.
Right.
Their perspective, and I'm not defending it, I'm just saying their perspective is, if you don't have a diagnosable mental disorder, why should we pay for it? And so that's why you have to have a diagnosis in DSM-5. And unfortunately, even then, not all diagnoses are paid for, and they have limited treatment options.
Well,
that's a whole other issue.
It's not a Batman problem.
No, it's not a Batman problem. He can get therapy whenever he
anything
wants.
Let's talk about plot armor. The Batman was born in Gotham City in May 1939 in Detective Comics number 27 to co-writers Bob Kane and Bill Finger. In that first story, The Case of the Chemical Syndicate, we learn that Bruce Wayne is Batman, but not why. 6 issues later, Finger and Kane spend 2 pages describing the tragic murder of Thomas and Martha Wayne, but it isn't until 1987 in Frank Miller's graphic novel Batman Year One that we're given some idea of how that event turned Bruce Wayne into Batman. And now every superhero has a deep and complex reason for being what they are. Has something changed about us as readers, as moviegoers, that we now demand to know an awful lot about our heroes?
Yes, I think, again, we're psychologically sophisticated, and being a superhero is such a sacrifice that we really want to know why. Why would someone do this? Why would someone have less of a personal life, be willing to be physically kind of beat up? Why would they become a social activist in this way? The story of their transformation is very powerful. I mean, we know in our world all the time we talk about storytelling and the power of storytelling. And so the origin story, the transformational story is, we want to know. It is powerful. And we see ourselves in it, or at least someone we know. I mean, like, we just want to understand, why would they do that? And so, yeah, we kind of, it's unsatisfying not to know.
Right. Do you think it's also that we want to be them? We want to be the heroes, so we want to see what parts of their lives line up with ours?
I agree. I think that's absolutely there. I've interviewed people at comic conventions when I've walked the halls of the exhibit area, and Batman actually comes up a lot, where people feel really inspired by him. People have said to me, you know, they look at his story, and if he can survive that, it gives them hope for their own lives. Yeah. I mean, that's really powerful, right? To be able to say, wow, compared to what he went through, my struggles are manageable, and I can dedicate myself in some way to finding the silver lining in my experiences.
The 1989 film Batman gave us tidbits of young Master Wayne's tragedy, and the 2005 Christopher Nolan film Batman Begins, we learn how terrifying it is to become Batman. And we love him for it. And we want to be part of all the anxiety and fear and horror of trying to live a decent life in the misery of Gotham City.
He's here. Who? The Batman.
How can we love that big pot of terrifying crazy that is Batman?
You know, I think that there are several pieces of the appeal of Batman. One is, it's the dark side, right? It's sort of that little bit of Darth Vader. You know, he's not the bright, shining knight that Superman is, or the sort of cute, funny Spider-Man. You know, there's a darkness there. Yeah. There's a real sort of sadness and struggle. Most of us can resonate with some of that. So there's an appeal. He's an underdog in a certain way. I think we like underdogs. Americans, at least, seem to like underdogs. There is that amazement at his personal sacrifice to make meaning of his life, and people do, that's real. I mean, again, that personal sacrifice to make meaning out of really bad experience, that is absolutely real, and we stand in awe of those people, and they are inspirational about when you've been dealt a really sucky deck, right? How to turn, you know, how to make lemonade out of lemons. Right. There is something fascinating and inspiring about that.
Yeah, yeah. Who's your favorite superhero?
So it's contextual. I have different favorite superheroes for different things, but as a psychologist, the superhero that I like the best is actually a version of Green Arrow that was, it's Green Arrow Year One. It's a comic book character written by Andy Diggle. And Green Arrow has many similar superficial characteristics to Batman.
Yeah, but he's a jerk. He does.
He's a jerk.
He's a jerk.
So his parents were wealthy. He's a ne'er-do-well. He substance abuses. He sort of jumps out of helicopters onto pristine mountains and skis down them. He gets other people to take these risks with him. He's not a very considerate person. And in his origin story, he ends up, long story, on a desert island. He has to learn how to fend for himself. He has a bow and arrow. He catches fish. He does all kinds of things. And for the first time in his life, he's happy. So it's the beginning of his transformation. He has learned to kind of earn his keep. And he really enjoys that, right? Because everything was given to him because he was wealthy before. Then on this mysterious island, it turns out there's some, nefarious goings on, and he meets this young woman who's in trouble, and he helps her. And in doing that, he feels really good. It's the first time in his life that he has really tried to help someone. So the reason that I like Green Arrow is because it's literally the very same characteristics that led him into trouble before the island that create meaning and purpose in his life after the island when he comes back home and is Green Arrow and is a superhero, because he has certain characteristics such as novelty seeking. He likes really highly stimulating activities. That's what the substance abuse comes from, that skiing downhill in these pristine mountains. And now that same characteristic is driving him to run into the face of danger, right, on behalf of other people. And these are behaviors, again, that's a silver lining, the meaning making he can feel really good about. He's quenching a thirst that he had, that he was sort of meeting that thirst with alcohol, if we want to use a metaphor, and now it's with Gatorade.
Or with helping.
Or with help. I mean, he's doing some same characteristic, different context.
And is that the meat and the bones of psychotherapy?
Sometimes, yes. I mean, a good psychotherapy can really help people figure out who they are, their strengths and vulnerabilities, and help them channel those in a way that suits them well, right? That makes meaning of who they are and gives them a path forward that is an opportunity to feel good about themselves.
Dr. Rosenberg, thank you so much. We're out of time. It's been such a pleasure to talk to you.
Thank you very much. It's been really helpful and illuminating.
I'll send you my bill.